Panretin Gel is used to treat skin sores in patients with a certain type of AIDS-related cancer, Kaposi sarcoma. Active ingredient Alitretinoin. Alitretinoin belongs to a class of medications called retinoids. It works by affecting the growth of skin cells. This medication should not be used when medications taken by mouth are needed to treat the Kaposi sarcoma. For example, if you have had more than 10 new skin sores in the previous mouth, or if the disease affecting the lungs or other organs. Indications. Panretin Gel is indicated for the topical treatment of cutaneous lesions in patients with AIDS-related Kaposi sarcoma, when lesions are not ulcerated or lymphadematous. Treatment of visceral KS is not required. Lesions are not responding to systemic antiretroviral therapy. Radiotherapy or chemotherapy are not appropriate. How to use. Panretin therapy should only be initiated and maintained by specialist physicians experienced in the treatment of patients with KS. Patients should apply Panretin to cutaneous KS lesions using sufficient gel so as to cover each lesion with a generous coating. Frequency of application. Patients should initially apply Panretin twice a day to cutaneous KS lesions. The application frequency can be increased twice to 3 or 4 times a day according to individual lesion tolerance, allowing no less than 2 weeks between dose increases. The frequency of application should be adjusted for each lesion independently. If application site toxicity occurs, the application frequency can be reduced as described below. There are no data on the efficacy of Panretin applied less frequently than twice daily. Duration of application. It is recommended that Panretin should be applied to lesions for an initial period of up to 12 weeks. Treatment of lesions that have not shown a decrease in area and/or height by week 12 should be discontinued. For those lesions that have shown a decrease in height and/or area by week 12, applications may be continued provided that there is continued improvement or at least maintenance of the response, and that the product continues to be tolerated. Treatment of any lesions that has fully resolved on clinical assessment should be discontinued. Contraindications. Hypersensitivity to retinoids in general, to the active substance Alitretinoin or to any of the excipients, pregnancy and breastfeeding, women planning a pregnancy, treatment of case lesions in close proximity to other skin disorders. Warnings. Retinoids as a class have been associated with photosensitivity. There were no reports of photosensitivity associated with the use of Panretin Gel in the clinical studies. However, patients must be cautioned to minimize exposure to treated areas to sunlight or other ultraviolet light. It is recommended that daily dietary intake of vitamin A should not exceed the recommended dietary intake value. Men using Panretin should take precautions to ensure that their female partners do not become pregnant. Avoid getting Panretin in your eye, nose, mouth, lips, rectum, tip of the penis or vagina. If this does happen, rinse with water. Panretin side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Panretin may cause serious side effects. Call a doctor at once if you have severe burning, pain, or irritation after using this medicine, blistering, drainage, oozing, or severe redness or swelling. Serious side effects may be more likely if you also have T-cell lymphoma. Common side effects of Panretin may include rash, itching, redness, or other skin irritation, skin peeling or flaking, scabs or crusting, or pain or burning of treated skin.